Good day, and thank you for attending or watching this video on your CPRS, how to access, and the compressed information. One of the prerequisites for this is that the user should take either the TMS or the Train CPRS tab by tab training. That is a part of the requirement for new residents. If you're a new provider, that information should have been forwarded to you from your supervisor. The first thing is how do you log into CPRS? If you'll notice on the screen share over here on the left, there is a VA Shortcuts Gold Star. So often you'll hear go through the Gold Star. You may have CPRS out on your desktop. However, we encourage you never to use that. The reason why is that if there's updates to CPRS of any sort, and they do happen quite frequently, you're not going to have a CPRS that will actually work appropriately, and you'll receive errors. If you contact the informatics or IT, they'll ask you to please always go through the VA Shortcuts Gold Star. So when you go into the VA Shortcuts, you are going to scroll down until you find CPRS chart AUG. You'll double click on that. And once you go in here, you're going to see the flash cover for Vista CPRS, and it can ask you for your PIV. There is an option that you can utilize your PIV card to log in to CPRS. However, you also still need to know your Access and Verify code. We encourage you to log in with your Access and Verify code at least once a month. So you will then put in your Access, your Verify code, and then you're going to hit OK. If you need to change your Verify code, or if you get a prompt to, you can always check mark, change Verify code, and you can change it there. After you log in, you're going to get a patient selection screen that will pop up. At the top of the screen, this is how you can actually select your patient. At the bottom of the screen, you have all your notifications. Please note that you are responsible for your notifications. Notifications can be anything from unsigned notes to unsigned orders, uncosigned, or additional signers. For those uncosigned, a report every week is submitted to the service chiefs to do those. You'll also find in here results for critical labs or abnormal labs, consults, imaging, pathology. All that is where you're going to manage those. Now, you may have to be careful. You may have one such as the one that I have just highlighted. This has an I, if you can see, right in the first column where it says information in that notification. This means that it is an information only order. If you double click on this order, it is just going to go away. We don't want that. You're not going to be able to retrieve it back, and you're going to have more problems. So if you do have information only or alerts, what you'll do is go to the center portion, take that initial of their last name and their last four, and select appropriately from this list at the top here. So I can then go into that record, and after I've completed whatever I need to do in regards to that message that you see down here for that highlighted order, I can then go and then delete that, or if I double click on it, it's just going to go away. So as I scroll through this, you're going to see that that order is now gone. So just be careful with those information only orders. You can sort these, so you do have the option of sorting it by patients, location, urgency, the date, as well as the message, or if it's forwarded from someone. And you do have options down here, your process information, you can process all, forward. Just be careful if you do forward one that you not forward unsigned notes, additional signer, or co-signers. What happens is for those notes that are unsigned or unsigned additional signer, those then go and get stuck with that provider, whoever you forward it to, and they will not be able to complete that. They will now have an alert stuck on there. If that happens to you, or if that happens, they will need to call the informatics department, and we will have to remove that notification for them. So please be cautious as to what you forward on here. At the top, if you need to do a default, if you want to do it by provider or team or specialty or clinic or award, you can actually do that. So say, for example, I'm working on the gold team, I can just click specialties, SP, and then gold medicine. And then I can just hit the save patient list settings. It'll ask if I want to do that, and then I can hit yes. And then if need be, I can select the appropriate patient. The other thing is if you click on all, it will show you the last patient that you were in, so you can actually see that patient information for any reason, such as it was timed out. Hey, what patient I was working in last, I can actually go there. So I'm going to select a patient. I'm going to say that they're part of my PAC team, and I'm actually going to go into the past. So I'm going to do actually a particular date range. So just be careful if you do a date range for this, you will get an invalid if you don't have your start to be later than your end date. So I'm just going to do 2 days. Actually, once again, just be careful with those dates. I'm going to go and do 2 days, and I only have one patient. So that is going to be my patient for today. And you'll notice it does have that information at the top with their date and time of the appointment. And then don't forget to always validate the full name of your patient, your full Social Security number, and full date of birth. Then it goes into the record. One thing that we want to bring up in regards to notifications is that you can set your notifications for less or more. To do that, you can actually go to Tools at the top and then Options at the bottom of the list. So just remember Tools, Options, and then there is a tab in this Options box that you can click on, and you can actually turn on and off what notifications you want to receive. The ones to be careful with are any of them that have info. What you're going to notice is this critical lab result, info versus action. The action is mandatory, so you'll never be able to turn those off. However, you don't want to necessarily have both an information and an action on there, because you will actually duplicate your notifications. So do be careful with your notifications as to what you're turning on and off, just because of those notifications. The other thing you can do is you can set up a surrogate. We encourage you that if you know that you're not going to be here for a week, or if you are going to be at the end of a rotation, or for any extended period of time, you have the ability to set up a surrogate for that time that you're off. So we encourage staff that you can do this yourself. Make sure that you work with your attending if you're a resident, or your supervisor, as to who should be your resident. So if you're working as part of a team, someone should be getting those alerts while you're away. It's really easy to set up a surrogate. All you have to do is, once again, it's the Tools, then the Options, Notifications. There's a surrogate settings button. You will click on that. You will enter the name of that surrogate. I'm going to put in Jennifer Kriegel to be my surrogate for today. And then I have to have at least a start date and time. Let me emphasize once again, it's a start date and time. So I will do my date range. I have to at least have a start date and time. If you don't have one, what happens is your notifications don't go anywhere, and they'll just sit there. And then you can hit OK. I have the option of now. And then I'm going to put in a surrogate for tomorrow, saying at 4:30. So I'm going to be pretending that I am gone for 2 days, or a day and then I can hit OK, And then if I hit OK again, but you can always review your information at the top here. And then once I hit OK, it actually brings this up here. The bad news is it doesn't tell you, like Outlook, that you have a surrogate set up. It will turn off at the end of that time period. If you have any questions on how to set up a surrogate, you can always contact the clinical informatics group and we'll gladly help you. And we will have those resources available for you at the end of this training. So that is how you set up your surrogate and your notifications. The next thing is if you want to set up a default location that's more complex than just a clinic or just a team or just the specialty, you can use the list teams. So tools, options at the bottom of that list. Then if you go to the tab that's called list teams, you can actually set up personal teams, but be careful with your personal teams. What happens if you set up a personal team is you're going to get notifications on all those patients that you set a team for. So if you have a personal team, make sure that if you're no longer seeing that patient, that you take that patient off that personal team. What I'm going to show you is how to do a source combination. So if I come up here to source combination under list teams tab, source combination, I can actually go in here and say, hey, this one already has some, so I'm going to remove those. If I click in the remove button, just highlight which ones I want to remove. Say that I want the wards for 6D, so I'm going to do 6D. And I'm doing medicine, so if I'm medicine only, I'm going to do 6D med and 6D obs med. And then if I wanted to, I can also do 4A. That's another one that we have med. And then there should be a 4A obs med. And then the same is true for 5D. So say if I want to only keep an eye on my patients for those wards, I can do that. But if I also have a clinic, I can actually put that in there too. So if I was, say, part of dermatology clinic or whatever, I can appropriately put that in there. And then if I wanted to also say, hey, I'm part of the specialty care or specialty team, gold medicine, I can add that. And then what happens is next thing you have to do is go to patient selection defaults, and you have to put the combination as your default. So you just do combination and then the sort order. So over on this left-hand side where it says list source, make sure it's combination. And then you can sort it either alphabetically, appointment, date and times, terminal digit, or source. And then once you hit OK, what happens is, if I go back to File, select New Patient, and that's how you change your patients, is you can actually go in here and see that it says default combination, and here's all the patients that are on those wards and any of those appointments, which since I'm in test account, there's not going to be any appointments, but I would see those there. Going back into tools and options, the next thing we have is notes. So this is how to create your favorite notes. There are several thousand different note titles in here. However, depending on where your rotation is, you may have 4 or 5 notes that you're going to use and no more than that. So if you are doing any of those notes, what you're going to do is you can actually set up that default so that at the top of that list are always those notes that you're going to do. If you want to also default your expected cosigner, so just remember tools, options, the notes tab at the top here for configure defaults for editing and saving notes. This is where you're going to go and put in that default cosigner. So if I could put in here Dr. Spencer if he was my expected cosigner, and I would just hit OK. If you want to do your note titles, I can actually go in here, work with your attending if you're a resident, or with your chief for whatever service line or specialty you're in, and then you can actually look for your notes in here. This screen seems to be a little small, but you do have scroll bars both at the top and the bottom, so you can actually scroll those over. So there's different ways that you can actually do your defaults. If you're working in a clinic or a specialty where you have to answer consults, you can even set up your defaults for consults. as well as for progress notes. So I'm going to do progress notes. So in this case, I am going to go and do specialty care, admission, history and physical. And then I can always hover my mouse over that note title and see the full one. If you have some that are in brackets like this, it's the same note that is down here that is not in brackets. It's just they have a synonym with that. So if I wanted to, I could go and add this. I already removed it. I'm going to remove it, but I'm going to add this one, and I can add more. So if there's other specialty care, such as allergy template, I could actually put that in there. Or if I was doing infectious disease, I can add that one as well. What's great is over on the right, you can highlight and put down or up and sort them in however you want. So if I'm doing an admission history all the time, but I'm not doing an infectious disease note H&P that often, I can sort those so that my most used that I would like to be at top. I can then click Save Changes, then click OK. And what will happen is if I go to the Notes tab, it is actually going to, and I do a new note, it's going to show you that list. There's a bar, and then I can scroll through, or I can search if there's a note that I need to utilize. The next thing we're going to do is go over orders. So if you have a patient and you're wanting to admit them, you're going to always write those orders as write delayed orders. This is true for both the admission and any transfers. So if you're going to transfer a patient or admit a patient, always make sure that you utilize the write delayed orders. What you're going to see it over on the left hand side of the orders tab right below the patient's name. So you'll click on write delayed orders and then select the appropriate one. So I'm going to go and select general medicine as an example, but you would pick whatever's appropriate. And then here is the delayed order. So once again, I'm going with the theme of the gold, and I will put in, if I am the resident, the attending's name. If I am the attending, I'm going to put my name or whoever's appropriate. And then I'm going to put in the resident's name. If you have a PGY1, you can put that intern's name. And then if you have any special instructions, you can put that there, but the instructions are optional. I will then accept order. What you're going to notice is right below the patient's name, you have active orders and delayed admit general orders. So if I need to switch between the two, I can actually switch between those two. Or if there's no orders, I can actually go in there and redo this. So it did not have any orders linked to it, so unless I sign it. But make sure that before you write any other orders for that admission that you always have that write delayed order completed. And one thing to keep in mind is that if you're putting in a name, it's the name, a comma, no space, and then the first name. So now I want to go over some of the information that is critical. The orders are always on the left. These are the ones that you can place. There's the acute care inpatient orders. Yours may vary depending on where you're working, but in here it will remind you that I'm doing this as part of my admission. No matter what service that you're working in, you always need to make sure that you put in an order for the diagnosis and the condition. This is a requirement as part of it. Reason for the admission, this is the diagnosis. I'm just going to put in here, this is a test, but you would put in the appropriate order. And then the condition. And this one is just a simple drop-down box, and you can actually put in here what's appropriate. You'll also notice in here, this is the most orders have the acute care. There is a lot of your most common used orders here just to make life easier. So if you need telemetry, any activities, it's kind of like one-stop shopping for your labs or any kind of nursing orders that are kind of common. There's also your DNR orders, your pharmacy, some of those, as well as your protocols. Then we have anatomic path. If you do any anatomic path, you have to put an anatomic path order in. Depending on if they're inpatient or outpatient, just remember to answer it appropriately. And if you're a resident, you will put in the name of your attending. If you're the attending, you'll put your name in there. And then you have to, a print sheet has to go with the sample. And then this is just a reminder to do that. And then make sure that all these fields are completed. They're all required. So the type of specimen, location, treating specialty, when it was obtained, the specimens, all that wonderful items have to be filled out. What happens is if you do not complete this thoroughly, it can delay care and a response. So make sure that you fill this out thoroughly. So that was the anatomic path. Blood bank orders, these are VBACs or blood bank orders. What I'd like for the emphasis on this one is that at the top in the first column, you have your type and screen, diagnostic only, and your ABORH. Below that, you have two columns. One is with a prior type and screen, and the second one is without a prior type and screen. So make sure that you pick the appropriate one. How do you know that you need a type and screen or not? You can actually go in the second column where it says for gathering information only, blood products, click on that, and it will bring up a report. In this case, this patient doesn't have any previous types and crossings nor any previous transfusions. So I can close this, and then I can actually know that I have to appropriately order from the second one. So here I'm going to do fresh frozen plasma, 1 unit. There's contraindications no matter what. Please read those. And then it will come up with an order set. There's 4 or 5 orders that you'll need to do. So make sure that you do the appropriate one as to when you need it, as the routine, any diagnostic tests that are needed. In this case, so you want to make sure you get those in there. And then if your reason for request, if it's a transfusion, hold until MD gives order, and any comments. And if you ever go through this, you'll just scroll down and then just hit accept order. It also reminds you that you have to order the nursing blood administration order separately. So make sure that you do that. So here is where I'm going to put in the instructions for the units, and then when I'd like this started, and you would put in this appropriate start and date time and the stop time. And I'll accept the order for that one. The next is the pre-transfusion criteria. This is required, so please make sure that you put in the appropriate diagnoses, if it's part of a surgery, what the surgery is. This was for fresh frozen plasma, so I'm going to scroll down here to fresh frozen plasma, but you do have your red blood cells and you have your platelets, and your cryoprecipitates. So make sure that you select the appropriate selections. You are required to put in at least the attending's name. In this case, I am CPRS attending. So I would be able to actually put in the appropriate name there. If I wanted to, I can put in the house staff. If you know the provider number, that's great. However, it's not required. And then whatever your specialty is. And then this will generate that. This is actually still part of that pre-transfusion criteria. You'll hit accept order. And the last thing that pops up is an order to remind you that you need to complete a blood bank post-transfusion note within 24 hours. So if you know that you're not going to be there in the next 24 hours after that blood transfusion, please communicate with your peers to make sure that that note is completed. That is a requirement for us to do that so that we can actually do those. So then what happens is I'm done with that blood bank order, and you'll see those orders down here. So that is blood bank. The next thing is if you're ordering consults, Please read these. What you're going to notice is it does say that stat consults require a warm handoff. It's very critical that you do that. If you order a stat consult, especially on a weekend, and there is no warm handoff, essentially you're delaying care for the patient. So if you have a stat consult, please, before you put that in there, to make sure that you have all that in there so that the those stat consults are completed appropriately. Not every patient's going to need a stat. While you may consider it a stat, it may not be appropriate for a stat for that specialty to see them. After you read the top about the stats, you're going to click on consult order menu. What you're going to notice is that we do have consults in here by the specialties in alphabetical order. Things to remember: if you need supplies, those prosthetics, these are things like your BP, different equipment that the patient may need, that is your prosthetics. We have non-VA care, which is also called community care consults. You have your Fisher House and Hoptel, so you have those there as well. So those are things to keep in mind in regards to different facilities, or different specialties, I should say, in regards to those. The ones that I want you to be aware of is there is called e-consults. If you have e-consults, this is not a face-to-face consult, but it's a curbside or an elevator consult. If you just have a question, this is where you're going to go. I'm going to utilize a e-consult today, but there's some things that no matter what, you're going to always need to do. So in this case, I'm going to do a ENT e-consult. There is prerequisites. Please, as a courtesy, to read the prerequisites. There may be valuable information in there in regards to what is required before you put in that consult. I will then hit continue, and in this case I'm going to put in the reason for a request. Some of them may be long. It'll have questions. Please answer those as thoroughly as possible. What this does is it makes sure that when your patient is being reviewed by the specialist, they will then appropriately make sure that the patient's seen. If you do not complete those appropriately, it can once again mean that there's delay in care. They may discontinue the consult because there's not enough information, or they may cancel and deny it. Some of our specialties, before you see them, they require that you get x-rays or lab work done prior to that notification or that consult. So please do be careful with those. In this case, I would enter the clinical history. This is where you will enter the clinical history and the question that I have in regards to it. So in this case, for the reason referral request, because it's the e-consult, they want to know your question and the clinical history as to why you're having this question. What happens is they will do a chart review and respond back with this consult. I can then go and complete this order right here. One thing to keep in mind is, and the attention, we encourage you never to use this. The reason why it's discouraged to use the attention is whoever's name that you put in there is actually going to get a large amount of notifications. So anything that happens with that consult, they're going to get a notification. It's not appropriate. There's other ways that we can notify them. So please do not use the attention in here. You are required, no matter if it's an e-consult or any of the consults, to put in a clinically indicated date. If it's stat, you can put in today. If it's one of those things where it's kind of subjective as to when the patient needs to be seen, you can actually change this. I'm going to say that my patient doesn't need to be seen for 4 weeks. We have a 28-day window that we're supposed to schedule in, but because of demand, it may be larger than that. So if it's one of those things where they don't need to be seen today or within the next 28 days, put in the appropriate date for that. And I know that's hard, but you'll have to use your clinical decision knowledge to make that decision. There's also a DST tool. is not required on this console, but for some of them you'll get more information hopefully from your area residents, just so that you're aware you're not responsible to use the DST, and that's the decision support tool. The other thing that is required for our consults, if you're ordering them, is the provisional diagnosis. So you will hit the lexicon button, and that button is right there, and then you're going to put in the reason why. So if I want to go and put in here vertigo, I can actually go in here and say that my patient has vertigo. If that's the reason why, I want to go and put that in there, and as the appropriate one, if I know the ICD-10 code, I can put that in there, and then I will hit the accept order. So any of the other ones, what you're going to notice, if I want to say go into cardiology, or any of the other ones, you're going to still note that they do have the e-consults up at the top. They may have more complex one if you need to do a face-to-face. And then here are those different kind of orders that we have that we can use as appropriately for those. So, and you'll notice that for this one, an example, it's pretty simple, very similar to what we saw. So, it just depends on your service. The next one I want to show you is diet orders. This is where you're going to order your diets. This is also where you're going to put in an order for MPO. So if you need an MPO a patient, you can go ahead and order that there. One thing to keep in mind is, in regards to MPOs, that you do not want to cancel an MPO. If you cancel an MPO, it will go and revert back to the old orders, which are discontinued. So that means that there is then no diet orders for your patient. So what you should always do is you'll put in a new diet order by going to the diet orders and then putting it in for the appropriate start and stop time for that. And that could be also if you need to do a tray outside of that. You can also order a meal tray in regards to those diet orders. So please keep in mind that if you're going to stop at MPO, don't discontinue it. What you're going to do is just put in a new order for whatever that start and stop time is, and it will be more appropriate. So there is that. The next thing is in here is after the diet orders, you do have your imaging orders. Things to keep in mind in regards to the image orders. Your plain films are your x-rays. We ask that you please always order from this. So if you need x-rays, go to the plain films x-rays. If you need a CT, an MRI, or an ultrasound, or any of those, please utilize those at the top. There's other things that you're ordering. You're not ordering just the CT, you're ordering a creatinine test that is going to be required, as well as if there's any contrast. So there's those to keep in mind. We really don't want you utilizing or backdooring orders, so please be careful if you're not going through one of these menus at the top. The other imaging orders should only be used very sparingly if you cannot find it any other area. And you can always contact or you can always contact imaging, or you can contact your attending or your supervisor as to what is appropriate. But for consistency of care and documentation, please utilize these orders either for the CT, MRI, ultrasound, any of them, for even your x-rays. The next order that we are going to go over is your self-tracking or self-alert tracking. Instead of keeping your alerts, if you want to just follow up, what you can do is actually create an alert through the self-alert tracking to go up in the future. So you can't do it for the same day as when you're wanting the alert, but it can be as soon as tomorrow. So there's instructions for use at the top for the different alerts, and then there's also click here for the tutorial. It's really easy to set these up. I know a lot of providers do, so that if they need to put in orders for labs or to review labs, this way you can manage your alerts. You're not inundated with alerts, and you're going to get follow-up alerts in regards to that patient for when it's appropriate. The last thing of the orders to go over is you have your return to clinic. These are required that if you're working in an outpatient clinic and you want to follow up with your patient, you always are required to do return to clinic orders. So you may have them in a different area. However, this is definitely the place where you always want to go in regards to those orders. So make sure you always utilize these. In here, it may have it as the default. In my case, I had AUG Pact 1. You'll never want to copy and paste a clinic name in there, and you'll always want them to be in caps. So if I went to AUG, I'd say I'm going into surgery derm or to a different one, I can actually do that. It's not going to work with lowercase. Make sure it's always all in caps. And then I can select the appropriate one. Then I can put in the clinic date. I can just click on the 3 dots or the ellipse and put that in there. Or I can do T plus. If I want to do 3 or 10 days, I can do TD and then enter, and it'll bring me in 10 days. If I want to do it, say, in 3 weeks, I can do 3W, and it's going to bring me the calendar for there. Or say if I want to see the patient in 3 months, I can actually go and hit enter after 3M, and I can go and put that in there for the appropriate one. So you have that. If it's time sensitive, i.e. the patient needs to be seen within that date range, an example is surgery wants to take out stitches. Those are very minimal time periods, so you want to be careful with that. If there's multiple appointments, so if you're doing a mental health rotation where you're seeing the patient, say that they're doing cognitive-based therapy and it's 10 sessions, I can actually go and make this 10, and then the intervals of days. So say that I want to meet them every week, I can put in 7 days, so you have those. You have your overbook options. Just be careful with overbook. We are limited on the number of overbooks we can have in a day, and then it doesn't just impact you, the provider, it impacts your whole service line. So the nurses, the MSA, so if we're having overbooks, it's going to delay care for others. If you select labs, fasting or non-fasting, that is only just as a reminder, so make sure those lab orders are also in there. And then if you have a duration that you want that appointment, you can put that in there as well. Comments, those can be a limit of 75 characters, and please don't use special characters such as the ampersand or the tilde, the bar, or the backslash or the forward slash. So you're going to have to keep it succinct. And then once you're ready to accept that order, you can accept it, and then you're done with that order. Just remember to sign your orders in a timely fashion, otherwise they will not get any alerts for those. So if I'm ready to sign them, I can highlight, and I can either right click or I can go up to action and sign selected. And you'll put in your signature code. So in this case, I'm going to put in my signature code, and then my signature code's in there. Next thing is notes. We already talked about how to set up your default note. One thing to keep in mind is before you sign your note, make sure that you do your encounter. You can always right click in the body of the note, either before or after you sign your note, and edit encounter information, or you can come up to action and encounter, and usually it's going to come up because I'm already in a note. I'm just going to say edit note encounter. And it takes a moment. And just so that you're aware, there's 3 tabs at the top: the visit type, the diagnoses, and procedures that you're responsible for. In this case, if you don't necessarily have a visit type depending on your clinic, but this is where you're going to get your office visits coded. If you're a resident, make sure that your resident is in there. So I have CPRS attending. I'm going to say that CPRS resident's going to be here. However, if you're a resident, your attending should always be marked as primary. In the middle here for visit type, we have service connection. Over on the left-hand side, you're going to have the different injuries that your patient has for service connection. And over on the right is where you're going to click, is this a service-connected visit or not? Depending on their injuries or disabilities is going to be what you're going to select. So the other thing is that if your patient does not have or has other options that are not grayed out, in this case, service connection condition is the only one that is not grayed out, you're always going to start from the bottom and go up. There is a known national issue with this, and that is their solution for right now. So depending on what their service connection, you'll select the appropriate one. If you don't know, you can always just go and hit no for all the other ones and yes at the top if you know it's a service connection. The diagnoses, you can have multiple diagnoses. One of them always has to be primary. One of the things to keep in mind is depending on your category, there's going to be different categories over here depending on your service. There's also the problems list. Just be careful. Say if I wanted to put this or how about if we do the hypothyroidism? This is out of date. The reason why I know it's out of date is because it has a hashtag or a pound symbol in front of it. So if I click on that to add it, it's going to have this window that pops up. I have to then go in and put in the diagnosis for the ICD-10 code in this case. And I'm going to select the most appropriate one from the list. Sometimes less is more. Now it looks like it is actually going and saying, hey, I'm asking for it again. It's not. If you look at the top, it's saying, hey, you wanted the ICD-10 on the last one. This one, they want the SNOMED code. So I'm going to put in hypothyroidism. And what's really nice is for the SNOMED code, it actually brings that ICD-9 code that you selected, so you're not having to remember. If it has an arrow, I can select more. And then I can add that to the list. There is a primary button over on the right hand side, and if you need to remove one, you can always remove it. Procedures, oh, and the other thing is you can always add it to a problems list. So if there's one that's not on the problems list, this is probably your best place to add it. Procedures, if they're not in here with the procedure section, you can always also look for them here. So if I want to do an injection, I can actually, or say if I want to do an immunization, I can actually search for that and then select the most appropriate one. Most of the time, your list is going to be already up there within the procedure section, so you have those. So if I was going to want to do an injection, I could actually put that in there and then whatever the appropriate modifiers are. Once you're done with that, you can hit OK, and all that information is going to show up at the bottom of your note. So you do have that there. The last thing I'm going to show you is your consults. If you're responsible for answering consults, some of you may be working in areas that are specialty, you can actually go over to the consults. This is where you should always answer them. If you're reviewing consults, or if you have a patient that no-shows or you need to make a comment on it, the first thing you should always do is go to Tools and Consult Toolbox Enable. And then within here, what you're going to do is it does nothing, don't panic, but you're going to go and do that Tools, Consult, Toolbox Enable. What this happens is if I go and click on a consult and I go to Action, Consult Tracking, and say that I want it to, in this case it's complete, but if say I wanted to add a comment, so if my patient had no-showed, what's going to happen is it automatically right-clicks for you, and then for our clinicians, there's the clinical review options. This is where you're going to make those options. So you have established patient, that's one of those items that you have. There's also community care referrals, so if there's you have that. Right now we have the COVID-19, so you have options here. There's also the alternatives for the face-to-face. There's additional scheduling, comments, and instructions. You can put those there. So I can even check them all. I can put in any comments, and I can put in, hey, schedule, and it's okay to overbook if I want to schedule on that. If I don't click the priority one, and those are very particular patients, if your patient's not priority one, please don't click on that. Additional flags, you may have a patient that's no-showed significantly. You can have requests that after they go through the mandated scheduling efforts to discontinue it. And make sure that if you're going to mark this as scheduled with the ordering provider, to add them on there. You may have a patient that is high risk. If you do have a patient that's high risk, they may warrant extra additional calls. and so you have these options that you have here that you can actually do. And then it pulls all that information in there, but I can still add more. Just remember, do not modify anything that automatically pulls in. You can put in additional information below. The next thing is you have your send additional alerts. So if I need to alert additional people, I can actually go and do that. Just be careful with the names. If you're going to go and do this, you may have patient or providers that have very similar names. As an example, there's 2 Cynthia Clarkson here. Do you want the RN or do you want the LPN? I can tell you the LPN actually works as she is the new employee or the employee health area, so just be careful with that. So you can add additional folks on there. And once you're done, it actually pulls that in there. If you have any additional persons, they will be alerted. If you need to answer a consult, once again, we always ask that you answer those consults through here. You'll go once again through action, consult results, complete, update results. Everything that you're going to have in here, once you start this, it will actually bring up templates, the reminders, and you have to select the appropriate one. So a consult has to be completed with a note that has consult in it. You can do it through the notes tab. However, we strongly discourage that because providers have been known to not link that note, and then we have an open consult and we're measured on our consults. So you would complete this just like you would any other note. In this case, I'm going to delete. The last things that we have is the toolbox. One thing I'm going to bring up is, and through here, is that you do have multiple options. Just remember you have your tools and options, and this is what it looks like in our test environment. I'm going to take a moment to pause, and I'm going to go into the production so you see what it really looks like. So now I'm in the production account. We are now going to show you what the tools looks like. There's a lot of critical information in here. So one of the things to keep in mind is that you do have your imaging display. So if you need to get into Vista Imaging, you're going to click Vista Imaging for Windows 7, not for Windows XP. It does take a moment for Windows to pop open. While it is doing that, I'm going to go through some of the other options that are available in here. One of the others is IMED consent. You have your sales, you have notification strategies. If you're working in primary care or if you would like SuperVista, that's another one up to date. There's the after visit summary. Keep all those in mind. We ask that everyone visit the HIMSS resources. It's particular about the do not use abbreviations. That is very critical that you document appropriately. There's applications utilities. These are things such as the ANI, if you want to use email, calculator, secure messaging, specialty applications, those wonderful things. There's web links and guidelines that if you click on that, it's going to go to a different one. One of the other things is we have a process through CPRS where if you need to retract a note, this is where you're going to go. So you'll always remember if I need a note to be removed or if I need a note title to be corrected, say I forgot to go and link I did not utilize the right note title and it needs to be linked to a consult, or if I have it on the wrong clinic, you can actually go in here to Tools, Incorrect Note, and then Note Correction, that's a note retraction. There's a clinic correction and note title correction. Any of these are going to have very similar. If you want a note removed or retracted, make sure you always do an addendum on that note. What this does is it generates an Outlook message that you will complete. You don't have to do anything, and please do not remove the subject. That has the patient information. At the minimum, all we need is the date and time of the note. If you would like to put in the note title, that makes it really great. The other thing that you can do is if you go to the note and say, hey, I have this note I want removed, I can always just copy right here this information using your hotkeys, and then I can go back to that email and I can actually put in all that information right there by pasting it. If you need a visit, delete it, you can say yes or no here, and then all you have to do is hit send, and the appropriate staff will receive this and retract the note or make those corrections as appropriate. I'm not going to keep that there for today just because this is for testing. Going back into imaging, there is multiple windows that pop up with this. One of the more important ones is this one that I'm moving around. This is the main one. So you're going to have one such as this scanned image. These are an IMED consent that was popped up for this patient. But if I have other images, there's a progress notes. I'll just give you a list. If my patient had any radiology exams, there's a box for that one, and I can actually click on them there. The main ones that we utilize, there's a list view, and that's here. If it has a note title, that means that it is a list. It probably is more than likely a scanned image. If it has a procedure with no note title, it's probably a procedure such as an x-ray. In this case, this is an x-ray for dental, and I can actually see those images right there by clicking on them. There's also a thumbnail view, and you notice I'm also clicking those, so I can actually look at these as a thumbnail. It's a little more difficult, but you can actually pull up those records for that thumbnail view. If you close everything out and you still have this open, what's great is that if you click on the one that looks like a sheet of paper or the lines in that square, that is your list view. If you click on the 3-story building or the ones that have little dots in them, that is your thumbnail view. And if you need to go and see your EKGs, Muse, stress testings, tracings, this will give you this. I'm in a test patient, but what you would normally see is there would be a list in the upper right hand corner and the tracings would be down there. So you do have that. The next thing I'm going to show you is the IMED consent. If you're doing any procedures, make sure that your patient is appropriately consent. Nationally, the VA has chosen IMED consent. It's an electronic system. It means that you have an appropriate one. Now, if the patient does not want to sign through IMED consent, that is fine. Just follow the appropriate guidelines to make sure that it goes to the scanning area. Once you get in here, you have over on the left different ones. You have all documents. Once you start utilizing IMED consent, you will develop a list of favorites. And then if you have any unsigned documents for your patients, there'll be a red documents to sign for that patient. So they're by specialty category. In this case, I'm going to select general surgery. Under there, you have consents, basics, step by step, which means it's a longer process, but they both use wizards, drug information, educations, patient instructions, pictures and diagrams, and tests and admissions. In this case, I'm just going to go into consents, say that I'm going to be doing a umbilical hernia repair. I would prefer laparoscopic. However, there may be the potential that it's going to be open. If I single click on each one of those that I want to do it, or even if it's robotic assistant, possible open, I can go and actually combine all those consents together into one. And then at the bottom right-hand corner, I can click on Begin Consent. It'll take a moment, but it will start a wizard for you. And within this wizard, what it's going to do is it will bring up some questions for you that you'll need to answer. The first one is, does the patient have decision-making capacity? Yes or no. You can do the appropriate one there and then hit next. Is anesthesia required? Yes, no, or moderate. If you want to have yes or no on the current DNR orders, blood products, if you know they're going to be anticipated. The comments are optional, but if you have vendor, it's going to be present, or tissues or patient information is going to be disclosed, you can put that in there as well. If it asks for a site and location, please remember to always use no abbreviations. Never use abbreviations, and try to keep it in layman's term. A consent is also a is also a education document. If you're a resident, you're going to put in yourself first. So in my case, I could put my name in there. If I don't exist, that would not be good, but I could actually put that in there, but your name should be in here if you're set up correctly. If you are a resident, make sure that your supervising practitioner is in there next. And then you'll hit next. And then if it's part of a team, you can actually put in the whole surgical team. This way, if you don't know who's going to be doing the procedure, you can actually put in that whole surgical team in here and it covers everyone. So you're not having to reconsent on the day of the procedure. So if I wanted to, I could actually put in those other persons. It's not just one name. I can actually put in several names. And those would be listed and it would cover for everyone. Once I'm done with that, I can hit finish. And then what you'll have is reminders. Please read these carefully. They go over some very important things that you should be doing when you're doing consent. And then you have a draft version of that consent. And you can review this with the patient. If you need to make any corrections, you have edit options over in the upper right-hand corner, and you can use those. You have a print option. You can hold for signature. It will actually hold the signature for 60 days. When you go back into the patient record and then go back into IMED consent, it will show up in red that they have a incomplete or unsigned consent. And then you can always cancel it. You can also adjust the text size or zoom in and out for that. So if I'm ready to sign, I can just go and sign this. Yourself, if you're the provider, can sign first, or if you want the patient to sign, you can actually do that. In this case, say if I wanted to skip, I can skip. There's information on that. Just be careful and read all that, and I can have the patient sign, and then I can hit save. And if I want to go back and sign as the provider, I can hit the sign button now, and I should be able to sign. It'll just take a moment usually, and then I can sign. And then you can print. We encourage you to ask the patient would they like a printed copy both before they sign it and after they sign it. And then once you're done, you can hit save to chart. Don't close IMED consent until you have the pop up right here where it says documents has been saved to IMED consent server. And then usually you'll be able to see it in the notes tab within 3 or 4 minutes. You can just do a file, refresh patient information, and eventually it will show up. Under tools, also, the last thing we want to go over is CPRS information. There's a lot of critical resources here. We don't expect you to remember everything, but under tools, CPRS information, it's going to bring you to a SharePoint. In the SharePoint, this is where you're going to get a lot of basic information. So under NEO resources, these are things such as your IMED Pocket Guide, how to use that, how to manage your alerts, Consult Toolbox, how to utilize that, how to complete consults in your encounters. Incorrect note instructions are right here. If you want to set up a surrogate, we have that option there for you. Linking your PIV card. This is the instructions right here on how to link your PIV card to CPRS and Vista. Just remember to always remember your signature, your access and verify code. One of the other things is make sure that your signature code and your signature title is correct. The reason why we say that is if you're in a note, and I'll just use this as an example, you should have, when you sign a note, there should be 2 things. It should have your name and your title. If you're a resident, it should be all in caps and it should say resident supervision or resident physician. If you're a physician, it should be either physician, MD, or attending. And if you want to put your specialty in there, you can. Just remember it has to be all in caps. So there's instructions on how to do that there. Clinic medications, if you're working in HEMONC, there's that. And there's more information on how to manage your notifications and counter forms. And then CPRS education, decision support tools, and joint legacy viewer is how you can actually see records outside of this VA. If you want to look at records in the community or at other VAs or DoD, there's information right there. The last thing we have is how do you contact the CACs? If you click home on this website, it's going to actually bring you with the information. The CAC's email is aug-cprs-site. So it's aug-cprs-sicte@va.gov. And then here's the information on how to contact the CACs. So hopefully if you have any questions, please do feel free to reach out to us. Thank you for completing this class. You will get instructions on how to show proof so that you can get access to CPRS as part of that email. Thank you and have a great day.